Hi, everyone. I'm Steve here again with Dr. Nario. Thanks for being here, Doc.
Hi, Steve. Thank you for having me again. Always a pleasure.
So, we're going to talk about something very interesting. You called it oil pulling. And this can be, you were kind of telling me before we turn this on, it can um, be a benefit for those trying to prevent Alzheimer's and that type of stuff. So, um, if you guys want to know more about Biointegrative Health Center, where Dr. Nario is, you can look them up online. It's Biointegrative Health Center in Reno, Nevada. And if you're interested in our weight loss program, you can use the QR code on the screen or the link in the description. And as always, subscribe to the channel if you like interviews with doctors, nutritionists, and personal trainers. Oil pulling. I've never heard of it. You asked me, have you ever heard? No. And you kind of sound surprised, something I've never heard of. Uh, but I haven't. So why don't you first tell us? I mean, I have so many questions. Not only what is it, but how does it benefit our health? And we're talking about your mouth, really, not just your teeth. But tell us what oil pulling is.
So, Steve, oil pulling is something that really is an ancient Ayurvedic oral care practice and recently gained attention in integrative anti-aging medicine. So, there's a lot of anti-aging benefits there. Ayurveda views it as basically, this is Indian tradition, views it as detoxifying ritual that draws out impurities and enhances the systemic vitality, while modern science is beginning to study its impact on the oral microbiome, for example, and systemic inflammation, thus leading to our anti-aging benefits. And oil pulling, so this is not you pulling oils from somewhere, it's actually swishing edible oil in the mouth. And this is reducing oral microbial load and also lowers gingival inflammation and some oxidative stress markers, and may be a low risk adjunct to standard oral care. Because oral health drives systemic inflammation or inflammaging, and it's linked to cardiovascular disease, diabetes, neurodegeneration, and also improves oral microbiome. With measures such as oil pulling may contribute to slow age-related decline and should be seen as an adjunct or not a replacement for proven dental care.
Hmm. So your mouth really has a lot to do with your health, doesn't it?
Correct. That is correct.
Huh.
So yes,
Okay.
so as you mentioned that, I just want to put it out there that when we talk about the mouth, so why is this important? Because chronic periodontal infections, oral infections, create systemic inflammation, meaning increasing your CRP, IL-6, TNF alpha, increasing oxidative stress. And that's why I mentioned to you the diseases a while ago that were related to that are there. But the one that really kind of gets us going here is the cognitive problem. So there is meaning when we talk about a bacteria, it's called P. gingivalis. So when they were actually doing, so this is a study done in 2019, that in Alzheimer's brains, they found that this specific P. gingivalis organism in your mouth actually was seen in these brains with Alzheimer's when they actually did a biopsy on it. So talk about nitpicking, we really picked out that brain. And that's why this is one of the bigger drivers why our patients are motivated to do this, because, oh, it will also help my brain in relation to preserving it.
So how do you do this? You said you can use coconut oil, which is firm at room temperature, but you can use other oils that you wouldn't want to eat, but they still have, you said they still have benefits. So how do you do this?
So that's a good start on how we definitely can initiate this, would be choosing the oil, right? So organic virgin coconut oil is favored because of the lauric acid it contains, or even sesame, sunflower. Again, we're not going to swallow this. We People are, oh my God, he's promoting like seed oils. So this is definitely not the point. And sesame and sunflower is, as I mentioned, is a preference if you have allergies to virgin coconut oil. So that's the preferred one because of the lauric acid, and also the taste, and it doesn't have that much bad after effects. But in Ayurveda, in traditional settings, they always want to prefer sesame oil And again, this is if these are locally available, these are the ones that you probably should choose. But again, coconut and sunflower and sesame are the ones that are actually more used by the ones who does this specific method.
So I would use, if it was me, I would use coconut oil because it is in your mouth. What about avocado oil?
That is not part of the list, unfortunately, just because in how, I guess, thin it is. So this one, if you notice, these are thicker oils that has just that ability. So how this works really is because when you talk about these specific oils, what does it do? It actually mobilizes and traps bacteria, meaning the swishing action that you do is making a soap-like emulsification effect, meaning the debris and soluble toxins will be now stuck in the oily film, and then you will spit it out, thus reducing the oral biofilm mass and also the bacterial load that you have. And also, when I say coconut oil, lauric acid, and monolaurin, it is known for antiviral effects, antibacterial, and even antifungal. So whatever's in there is of such nature in your mouth, they're all going to go out through the door. They also have anti-inflammatory, antioxidant effects, as we know, and also I'm sure we're gonna swallow some of this. For some might go through the cracks, and that's why the microbiome benefits from these healthy oils as well. And it actually creates a lot of good bacteria if it goes down your lower gastrointestinal tract.
Sure, I'd rather swallow coconut oil than any of those
Right,
other seed oils.
right.
So you just take a spoonful of coconut oil, let it melt in your mouth, and swish it around.
So here's the process. So 1 tablespoon, around 10 to 15 mils, and usually morning on an empty stomach before brushing your teeth is the Ayurvedic or traditional approach. But often with our busy schedules, we incorporate this in the evening bedtime routine for convenience sake. But either way, it can still work. And 10 to 20 minutes, it's not just 5 seconds, 10 seconds of gentle swishing back and forth movements of this oil in your mouth. The shorter would be around 5 to 10 minutes. That's also acceptable. But really, the benefits have been seen with 15 to 20 in studies and clinical trials. So, and again, do not gargle. This is just gentle swishing. And you could probably watch your Netflix or YouTube videos while you're doing this or read a book. And then move the oil between your teeth, your cheeks, and avoid vigorous suctioning, of course, because of the stress on the TMJ part, and then you spit. Well, you just don't spit anywhere. You're not going to spit it on any sink. The reason for that is when you when you spit it out on a sink, it can clog up your drains. So spit it in a tissue or a trash can or a container, then rinse your mouth with warm water because warm water will dissolve that also. And then after that, brushing can now manually and mechanically remove whatever leftover organism is there. And lastly, to cap it off, tongue scraping. So this is actually in Ayurveda medicine. This is the last key step to remove toxins, or they call this in term ama. And the traditional material that you will use for these scrapers would be silver, because of course the antibacterial effects of silver. But if you don't have that, copper and stainless steel scrapers are also good.
My wife does tongue scraping.
Uh-huh.
And so can people just kind of order that, from Amazon or wherever?
Yes,
Uh,
that's thumb scrapers. Is that what you're saying?
yeah, so just look up tongue scrapers.
Scrapers. And that also, again, silver, as you would know, it's a little bit more pricier than the other ones, but they still all work. And suggestions here would be daily for 1 to 2 months, and then 3 to 4 times a week. It doesn't have to be every day. And again, daily is always what I guess the clinical trials shows benefit more of. Again, if it's too much for you, 3 to 4 times a week will be fine.
Well, I'm going to try it.
Mhm.
Um, and,
See, you got on it. You got hooked
yeah,
to it.
I just kind of want to tie this all up. You said things that it helps prevent, but can you just kind of briefly touch on before we go? Tell us about the benefits.
Right.
I mean, I know it's kind of opposite of what it prevents, but just touch real quick again on the benefits of this.
Okay. So the benefits why it's promoted, and also according to clinical evidence, this is actually lowering down the systemic inflammation, which is specifically CRP, IL-6, TNF alpha. The reason behind that is because our mouth is actually releasing, or I guess it's a home for all the microorganisms in the mouth. And you have to remember, every tooth is an access to different organs. And when I mentioned to you about the bacteria, specifically P. gingivalis, accessing the brain in Alzheimer's, that's an evidence for you that some of these bacteria can also access your heart, can access your liver, can access your lungs. And when we talk about anti-aging, we're actually talking about inflammaging. So when these bacteria now travels to these specific organs, they will not produce inflammation that will speed up your aging process, not only as physically, but also inside, wherein you can also develop, for example, insulin resistance, diabetes, and even again cardiac problems. So that's why you always have to remember this is an act that is focused on one area of your body, which is the mouth, but it actually is the systemic spread or effects that we're more concerned about.
Well, all right. So I mean, it makes sense that you reduce inflammation. It's going to help your cognitive function and your heart health. I mean, it would seem like, okay, you reduce inflammation, that connects to lowering your blood pressure and uh, better heart health. So, all from your mouth. That's very interesting.
You have to remember the dirtiest part of your body is your mouth, not down there. It's right here because everything goes in there. We eat everything. That's why people kind of, the dirtiest part of the body, the first thing they think of is not this, but somewhere else,
Right.
right here.
All right, Doc. So, Dr. Nario, as always, thanks for this. Thanks for this information. And I'm going to try it. Thanks for being here.
All right. Well, Steve, thank you again for having me. As we all know, that knowledge is power. And thank you for letting me provide you with edge on longevity and health maintenance, which I call the biological edge or the bio edge.